So, welcome to another episode of Dr. Dav on anti-aging and wellness. And wellness is a broad field, but it includes looking good. When you look good, you feel good, it's all part of being a whole person, and patients understand that. And today we're going to talk about one of the first truly revolutionary things in aesthetic medicine, uh, botulinum toxin, which is commonly referred to as Botox. Now, nowadays we think of it mainly in terms of cosmetic usage, but the very first indication it was approved for by the FDA was for a condition in young children called torticollis, where the spasm of the sternocleidomastoid caused the child to look in the other direction. And by relieving the spasm, by putting in the neurotoxin, they were able to look straight. And since then, botulinum toxin has come a long way. But people still don't really understand, I find, that what it does and how it works. It works because it reversibly paralyzes the muscle action. And that's why the benefits of Botox only last 3 to 4 months. It's going to go away. 3 to 4 months, you have to keep coming back to have it done. And it works by paralyzing the muscles and allowing the creases that have formed due to overactive muscles from frowning or squinting. Eventually, those lines will become permanent. So the best is to start Botox early and to prevent those lines beginning to form. And so I have patients as young as 20 coming in for Botox. What age did you have Botox at?
So I started just when it came out at 26. But I was always looking for a way to stay young. So the day it came out, the day it was available, I think, in the US, is when I started using it. And back then, it was mainly known to be used for the forehead lines. Like it was, if you never want to look angry, then that's what you use it for. And I think I've been using it for so long. I think my frown, the muscles that cause frowning atrophied because I don't think I can really frown anymore, which is kind of a joke with my kids because I can get mad.
So, yes, these creases here are formed by the procerus muscle, and by weakening that muscle, these lines will go away. But what Victoria says is correct. Over time, with continued usage, the muscles will begin to weaken. So you will need less and less Botox over time.
So it's like the only thing that's actually preventative, right? When you talk about fillers, they don't really prevent that much, right?
Correct.
But Botox actually prevents future wrinkles.
That is, and it reverses existing wrinkles, but it also prevents them. But the thing with Botox is you have to keep up with it. There's no use having it done once and then come back to the doctor's office a year later and say the wrinkles are still there. Well, the Botox went away at 3 to 4 months.
And again, it varies from person to person. I know, like, I tend to be kind of a fast metabolizer, perhaps because I do like hot yoga and there's a lot of sweating, or maybe it's just individual differences.
Definitely heat will cause it to metabolize faster. Working out regularly will cause it to metabolize faster.
And it's not, I think the other thing is people, when it first came out, they were scared that it's somehow toxic.
That is a poison. It is a poison. That's why it's called toxin. It's a neurotoxin.
But it's not actually poisonous for the body. Like it doesn't migrate into your liver or anything like that, which is what I think a lot of people are afraid of.
Yes. In the micro dosages that we use for cosmetic purposes, we're using tiny, tiny dosages strategically placed to weaken the muscles that are causing the frown lines that the patient doesn't like.
So nobody actually got botulism from getting Botox?
No, no.
I think that's important to know, because there are still people out there, like, real people who are into health and who are, don't like fluoride in toothpaste and so forth. They also think that Botox is some kind of toxic. It's not.
There's a lot of misinformation out there, especially about vaccines and fluoride in the water and stuff like that.
But Botox will not show up in your liver or anything like that.
That's why we do this series, to explain to patients. So you are right. The first area that the FDA approved for the cosmetic use of botulinum toxin. Now see if you can make your frowny. See, over time, these processed muscles have softened up that you can hardly make an angry face. So when you look at your children, do they know that you're angry?
They know that it's hard for me to be angry.
It's hard to look angry. You might be angry, but it's difficult to convey that through the muscles of facial expression, because this is what we are doing. We are weakening the muscles of facial expression.
And here's the interesting part. What they found in the research is that if you can't frown, if you have difficulty frowning, your brain thinks, well, she can't be that angry if she can't frown. So it actually helps relieve depression in people. Botox actually has been shown to help relieve mood swings and depression. And a lot of people in psychology are actually looking to try to get Botox covered by insurance, because people, obviously, if you can't frown, it's called facial feedback hypothesis. Your brain thinks, well, she can't frown, so she can't. How mad, how angry, how sad could she possibly be? So if you disable the muscles responsible for the emotions, your brain also doesn't take those emotions as seriously and tends to perceive you as more happy. And that's the facial feedback hypothesis. So there's some movement in psychiatry and psychology to have Botox covered by insurance.
I believe the theory, but good luck with getting your health insurance to pay for it. Although health insurance does pay for Botox for migraine.
And tension headaches. Right?
And tension headaches, when the Botox is administered by a neurologist and there's a good record of treatment, that all other methods of treatment have failed. You can't just walk into your neurologist and say, oh, by the way, I have a migraine, give me Botox. It doesn't quite work that way. The insurance companies do not part with the premiums that they have earned so easily. So let's look at you and explain. So you did your frowny face to try and make these muscles, but these muscles are not terribly active. Yeah. Now lift your eyebrows. You see these transverse lines. These transverse lines form because the frontalis muscle, which runs up and down, is what causes these lines to form. And for someone of your age, these lines are very, very superficial, and that's because of your continued usage. Now just relax, and I can point out that you have this line setting in here, and that's about it. But I would still put in a little Botox in preventative overall, but this is the line I would focus on. And I will mark and show how I inject it specifically for that area. Because this is very specific. Which muscle are you trying to weaken? What are the countervailing muscles? And what are you trying to achieve by weakening that muscle? So there is a lot of knowledge that has to be acquired before you can just start injecting Botox willy-nilly.
Because it can actually paralyze part of the face.
Well, you have to know the safe areas. One of the commonest problems is when people are injected in an area which causes ptosis, because this muscle will come down because this was weakened. The muscle underneath pulls the brow down. So yes, there are problems that can happen with neurotoxins, but with careful and precise usage, usually that does not happen. So having explained this thing about ptosis, then we can talk about weakening the opposite muscle, because a lot of patients want a little lift of their brow.
Yeah, I definitely do. I wish it
Yeah.
opens the eye.
It would open the eye. Now, the way to achieve that with Botox is to weaken the countervailing muscle. These muscles here are the ones that pull down. So if you weaken these pulling up muscles will pull up. It's a very subtle effect. Botox kicks in 4 to 8 days in different patients. But again, once you understand what you're doing, then patients can appreciate how the brow lift was achieved. It's not a true brow lift. It is just by weakening the muscles. The elevator muscles are able to act more because the depressor or countervailing muscles were weakened. So the other common areas of usage, now smile. So you can see these, people call them smile lines, laugh lines. And again, over time, these will deepen and become permanent in the skin. So that's one good area to use them, to use Botox to prevent that happening. And so this is basically, Botox is primarily used in the upper third of the face. But there are other places that you can use Botox. One is to weaken some muscles. And yes, so you have these bunny lines, you can weaken that muscle. These muscles are actually very difficult to paralyze with Botox, but we'll try. Now the thing is, we'll demonstrate the injections, we'll demonstrate the markings, but you will not see the effects today in this video. We can have another video or add on to this video later on to show the results at a week. So the other areas that we can weaken to achieve a cosmetic effect is around the lips.
I feel like I have a grumpy cat look.
Grumpy cat look.
Grumpy cat.
I describe it that when cartoonists draw an unhappy face, they draw it with a down line, and when they draw a happy face, they draw the angles of the jaw in an upward pointing direction. And some people just naturally, because of their musculature and the way it is, naturally look happy all the time. And that's just because of the way their muscles are organized. But in a patient who complains that they have this downward look to the face, we can weaken this muscle here, and I'm going to mark it that right here we can inject, typically I'll inject 3 units, and this will weaken the orbicularis, the lower part of the orbicularis oris muscle, and leave the upper part unaffected. So since this is weaker, this acts more, and the corner of the lip will lift up. So basically this is how you're achieving that. By weakening the muscle here, you're not doing anything to the muscle there. It is just responding to the fact that the countervailing muscle is weaker. So we're going to continue to mark. So it would be here, and so this requires quite a lot of Botox. Typically I will inject 3 units here. And some patients have some corrugation of this muscle here, and I think we did at one time inject all these muscles here, and they seem to have smoothed out and lasted a long time. Now, the other more radical use of Botox is if you can clench your teeth. So these are the platysmal muscles. And people will say, patients will say, oh, I hate those lines in my neck. Well, you do need those muscles to bend and turn around and stuff. But if you leave them untreated, they will become deeper and more pronounced, and that's a sign of aging. So some patients, but it requires a lot of Botox.
And a lot of skill, right? Because if you could actually paralyze,
yes,
the ability
you have to inject right along the line of the muscle to be able to weaken it. So today the other areas we're going to inject is, remember this line that I pointed out here? So we just need minimal there. Now lift your forehead again. And just a few units around here and here. And that will last her and keep her going on
and
that.
The lift here. Right?
And she wants the lift, so
yes.
I will put in very, very carefully 3 units here to weaken this muscle down here so it can be lifted up. Just turn your head and so this has to be done very precisely because you want the arch of the eyebrow to be retained. And then I think we'll put in a few units here, even though what I tell patients is that to me the ideal result is when at rest you have no wrinkles, but then when you animate, people can see that you're happy or angry.
Not too frozen.
And definitely not frozen. I mean, that is just the most ridiculous look. You want to be able to interact with the world, and the world has to be able to see whether you're happy or upset.
And I know some people also put here to elevate and in the nose, right?
Yes, so there's a depressor muscle. Now, you don't have that problem because you have a beautiful nose. But if you have a drooping nasal tip, sometimes you can lift that up simply by injecting the depressor muscle down here. But again, that's not a problem that you have, so we don't have to do that.
And I know you're not a fan of a lip flip, that people do that.
Oh gosh, that's just, you'll end up drooling because you cannot form a proper O or suction. That was where people injected along the lips to try and evert the lips. And that is a procedure that was popular on Instagram. Yeah. And young patients would come in and say, I want a lip flip. And I would say, no, you'll be drooling when you drink. And then once you explained that to them, they would say, okay, but some of them still wanted it. And I'm pretty sure they went to someone who did whatever they wanted and were happy with that. So these are the areas that we're going to inject. And patients always say, oh, it's a big needle. No, it's not a big needle. The needle is the smallest needle that is made. It's 31 gauge. It's barely visible. Now, it does have to puncture the skin. So it is still bothersome, but it is not a big needle.
Yeah, it's just like an ouch. But then again, like if a mosquito bites, you would the ouch too. So.
You would definitely notice that too. So
I always say it's more than a mosquito, but less than a bee.
I'll have to remember that. So and I do it very quickly. I don't even tell the patient I'm going to do it. So here we go. And this is a beautiful syringe because it's actually marked in units. Because I know here I only want to inject 1 unit at a time in that area where I have marked. And I've pre-marked the area that I feel where the muscle needs to be paralyzed. So I can inject 1 unit at a time. And Botox will spread for about a centimeter in a circular manner around where it was injected. So if we inject here, the Botox is actually going to spread around there. So let's do the other side. Okay, and
then the eyebrows.
now the eyebrows. So 3 units is
That's
all
my
that you
favorite
need.
effect, the
That's your
eyebrows.
favorite
Because my
effect.
eyebrows tend to be low. I know with people who already have very arched eyebrows, they tend to get like more spocky look, but in me, it just raises them just right.
And that's why it's good to go to someone who knows how your face reacts to the Botox. Okay, and so finally we are left with
Again, usually people put it here. I don't need it here because I've been doing it there for so many years. That was the original.
And in some patients, you can actually lift this up and lift them off the table by pulling the muscle.
Really? Wow.
Yeah, and especially men. Men have much larger muscles, so this amount of Botox would do nothing for them. So when they come in and say, well, you need a lot of Botox, and I demonstrate the size of the muscles and why they need that amount of Botox, they understand. So let us do open your mouth, and it's easiest to hold the muscle and lift it up with my finger so I can feel the syringe and the needle going into the muscle and delivering the Botox where I want it. Now, I continue to use Botox as a generic term. There are many newer neurotoxins, and some of them have the advantage of the fact that they do not need to be kept refrigerated, and they are stable at room temperatures. And that is the biggest advantage of some of the newer neurotoxins. Okay. There we go. And that's it for this session. So if you want to get the full benefits of Botox, you need to have it done regularly. That's the thing that patients have to understand, that this is not a one and done kind of deal.
But the more you do it, the less you need it.
The less you will need. I mean, in a novice patient who had come, they would require a lot more Botox for these areas. Typically for a new patient, they will need 30 units up here, 30 units here, and 30 units here, which would be 90 units for someone who's never had Botox before. It may be a little bit less if it's a woman who's small and got small muscles, but it may be more if it's a big muscular man with strong muscles of facial expression. So it's important to understand what Botox does. It does not rejuvenate the entire face. And that's why when patients who are new to the concept of having work done and they say, I want Botox, they don't understand that Botox is just one of the methods in the toolkit to give you a refreshed look. And in other episodes, we're going to talk about fillers and how we volumize the face. And we're also going to talk about how we tighten the skin without surgery. And there are different ways to do that. But my favorite is what is colloquially called threads. This is a very simple term for something which is quite complex, which is actually barbed sutures mounted inside a cannula, and you can put the cannula underneath the skin, withdraw the cannula, and tighten the skin over the face. And this is a very popular technique now because it has the advantages of lifting and tightening the skin without the downtime of a surgical facelift. Obviously, it's not as extensive, but basically, this is the miracle of how we're able to put sutures into the face without and tightening the face without cutting the skin. So
when you're going to talk about also lasers, because I know we've done some lasers.
That's a separate topic. I mean, in anti-aging and wellness and to look young, if you want a never-ending topic, this is one. And over time, we'll record videos, and we'll also record videos on the other modalities to prevent aging. The medications which may not be approved yet, but are available for
nutraceuticals.
And also we'll talk about supplements and nutraceuticals, and because there's only two things that you individually can change. The genetics and the DNA you were born with, you cannot change.
At least not yet.
Not yet. But the thing that you can change is what you put into your body. And we have a whole series on what to eat, what not to eat, what nutraceuticals are beneficial and which are not, which supplements can be used, and so anti-aging and wellness is basically a never-ending topic, and we will have more videos, and we hope to see you back again soon as we explore the wonderful world of anti-aging and wellness, something that everyone is interested in. Everyone wants to look better. Everyone wants that they should not live forever, but as they age, they should be healthy. And healthy aging is what anti-aging is all about. It's not about living forever. And the thing about healthy living is healthy eating and exercise. And we'll talk about all these things in forthcoming episodes of Dr. Dev's on anti-aging and wellness. Thank you.